Anxiety is a natural emotional response to stress, characterized by feelings of fear, worry, or unease. While it's a normal reaction to certain situations, such as a job interview, a big presentation, or a challenging exam, anxiety becomes problematic when it is persistent, overwhelming, and interferes with daily functioning. Anxiety can occur in response to specific situations, or it can be generalized and occur without a clear trigger. Types of anxiety disorders. 1. Generalized anxiety disorder, GAD. Definition: a chronic condition characterized by excessive, uncontrollable worry about a variety of different things, even when there is little or no reason to worry. Symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, sleep disturbances. 2. Panic disorder. Definition: recurrent, unexpected panic attacks, intense periods of fear or discomfort, which can lead to ongoing worry about having another attack. Symptoms: rapid heartbeat, sweating, trembling, difficulty breathing, chest pain, dizziness, nausea, a feeling of choking, or a fear of losing control or dying. 3. Social anxiety disorder, social phobia. Definition: intense fear of social situations or performance situations where one might be judged or embarrassed. Symptoms: excessive worry about being negatively evaluated by others, sweating, trembling, blushing, or avoiding social interactions altogether. 4. Specific phobias. Definition: intense, irrational fear of a specific object or situation, such as heights, flying, spiders, or injections. Symptoms: a strong desire to avoid the feared object or situation, which can interfere with daily life. 5. Obsessive-compulsive disorder, OCD. Definition: recurrent, intrusive thoughts, obsessions, that lead to repetitive behaviors or mental acts, compulsions, performed to reduce anxiety. Symptoms: obsessions, e.g., fear of contamination or harming others, and compulsions, e.g., washing, checking, counting. 6. Post-traumatic stress disorder, PTSD. Definition: anxiety and other symptoms that develop after someone experiences a traumatic event. PTSD can include flashbacks, nightmares, and hyperarousal. Symptoms: intrusive memories, flashbacks, avoidance of reminders of the trauma, and increased arousal, e.g., difficulty sleeping, irritability. Symptoms of anxiety. Anxiety symptoms can vary greatly depending on the individual and the type of anxiety disorder, but common symptoms include: 1. Physical symptoms. Rapid heartbeat, palpitations, sweating, shaking or trembling, shortness of breath or a choking sensation, dizziness or lightheadedness, nausea or digestive issues, muscle tension, fatigue. 2. Emotional symptoms. Persistent worry or fear, restlessness or feeling on edge, difficulty concentrating or feeling like your mind is going blank, irritability or nervousness, a sense of impending doom or danger, feeling detached or unreal. 3. Behavioral symptoms. Avoidance of certain places or situations that cause anxiety. Compulsive behaviors, in the case of OCD. Excessive checking or reassurance seeking. Causes of anxiety. Anxiety can be caused by a combination of factors, including 1. Genetic factors. A family history of anxiety disorders can increase the likelihood of developing anxiety. 2. Brain chemistry. Imbalances in neurotransmitters like serotonin, dopamine, and gamma-aminobutyric acid, GABA, can contribute to anxiety. 3. Personality factors. Certain personality traits, such as being more prone to stress or having a tendency to worry, can make someone more susceptible to anxiety. 4. Environmental stressors. Major life events like trauma, financial stress, or relationship issues can trigger or worsen anxiety. 5. Health issues. Certain medical conditions, like thyroid problems, heart arrhythmias, or respiratory issues, can cause symptoms of anxiety. 6. Substance use. Alcohol, caffeine, and certain drugs can exacerbate or mimic anxiety symptoms. Treatment for anxiety. Anxiety disorders are treatable, and many people can manage their symptoms effectively with the right approach. Common treatments include 1. Therapy. Cognitive behavioral therapy, CBT, one of the most effective therapies for anxiety. CBT helps people identify and challenge negative thought patterns and behaviors that contribute to anxiety. Exposure therapy. A form of CBT where individuals gradually confront situations or objects they fear to reduce avoidance behaviors and the intensity of their anxiety. Mindfulness-based stress reduction, MBSR, focuses on increasing mindfulness through meditation and relaxation exercises to reduce stress and anxiety. Acceptance and commitment therapy, ACT, encourages individuals to accept their anxious thoughts and feelings rather than trying to control them and helps them engage in behaviors that align with their values. Two, medications. Antidepressants, SSRIs, SNRIs, medications like sertraline, Zoloft, fluoxetine, Prozac, and venlafaxine, Effexor, are commonly prescribed for anxiety disorders. Benzodiazepines. Drugs like alprazolam, Xanax, or lorazepam, Ativan, may be used for short-term anxiety relief but are typically avoided for long-term use due to the risk of dependence. Beta blockers. Medications like propranolol, Inderal, may help manage the physical symptoms of anxiety, such as shaking or rapid heartbeat, especially in social situations. 3. Lifestyle modifications. Exercise. Regular physical activity can reduce the physical tension and stress that contribute to anxiety. It also promotes the release of mood-boosting endorphins. Healthy diet. A balanced diet with a focus on whole foods, avoiding caffeine or excessive sugar, and staying hydrated can have a positive impact on mental health. Sleep. Getting enough quality sleep is critical for managing anxiety. Poor sleep can exacerbate anxious feelings. Relaxation techniques. Practicing mindfulness, deep breathing, progressive muscle relaxation, and yoga can help reduce anxiety symptoms. 4. Support systems. Talking to friends, family, or a support group can help alleviate anxiety by providing emotional support and reducing isolation. Support groups, either in person or online, can be a valuable resource for sharing experiences and learning coping strategies. Coping strategies. 1. Deep breathing. Slow, deep breathing can help calm the body's stress response and reduce feelings of anxiety. 2. Grounding techniques. Use sensory techniques, e.g., focusing on what you can see, touch, hear, smell, or taste, to stay present in the moment and manage anxiety. 3. Journaling. Writing about your worries and feelings can be a way to process anxiety and gain perspective. 4. Structured routine. Creating a daily schedule with breaks for relaxation and self-care can help reduce stress and keep anxiety in check. When to seek help. It's important to seek help if anxiety is 1. Affecting your ability to function at work, school, or in social situations. 2. Causing significant distress or impairing your relationships. 3. Leading to physical symptoms that interfere with your health. 4. Persistent and doesn't improve with self-care techniques. A mental health professional, such as a therapist or psychiatrist, can help diagnose anxiety disorders, provide effective treatments, and offer coping strategies tailored to your needs.